Hi everybody, how are you guys doing? Welcome to Skin School. Sorry, last week I was in London and we missed out on Skin School. I'm trying to really do it every week, and yeah, you know, I love doing it. And today actually something very interesting. I invited a friend and a doctor from Viva Maya, Dr. Maximilian Schubert. He's a genius when it comes to gut health and what you need to do for your detoxing and vitamins and overall health for your system. And I find it so interesting, and we've been talking on our live chats quite some time, and it's so good to understand a little more about like this whole idea of an overall situation regarding our skin, not just our skin but also our health. And interestingly, Dr. Schubert also is an orthopedic doctor and also is very much focused on anti-inflammation. And when we met, we had a lot to talk about, and he's very successful in his job. He has hardly ever time to come and be on lives anymore because he's so busy. But I will introduce you now, Dr. Maximilian Schuart. Thank you, Max, for joining us today. So cool. I'm glad you had some time.
Yes, of course. Thank you very much for this nice introduction. I'm very pleased of joining the Skin Masterclass again and giving you some of my thoughts and also some of my experience with the relation of skin and gut issues, which, as you said already, has the common source of inflammation. So I'm really happy to be online this evening. So it's evening in Austria already, so it's morning in LA, and in some other parts we will have different time zones as well. So I'm happy to be with you together. Thanks for invitation.
Yes, of course. Let's talk about inflammation. Let's just dive right in. Inflammation, why is it so important? Why are we talking about it so much? I think before you and I talked about, nobody talked about inflammation, and all of a sudden it's just like such a big thing. And why is it so important? What is inflammation?
For us, inflammation is actually the common source of any kind of civilization disease. Our body has, actually our immune system has one possibility as a deficiency mode and increasing their power by causing a local inflammation. So whatever causes a problem in our system has, as a reaction of the immune system, increased inflammation. Why? Because inflammation, local inflammation, normally means more blood circulation, and all our immune cells are actually coming to the place where they are needed by our blood system. So it makes absolutely sense to increase inflammation for our body. The main problem is not only locally that we have a lot of inflammation in different parts in our body, which we can be aware of. And as soon as we are aware of those so-called silent inflammation, we can start to reduce it. And one of the most important things of reducing this kind of silent inflammation is healthy eating habits and healthy gut system. Yep. That's why we are focused on. And as another common source of both of us, of you, Barbara, and Viva Maya as well, is that we are treating mainly the skin. Yeah, you are therapying the skin, especially very high professionally from the outside, and also with the knowledge of what's necessary for the inside. And our main focus is mainly on healing the skin, in this case the mucosa skin from the inside, with some extra knowledge which we achieve, which we get better and better by our sessions and our cooperation as well, and from the outside. So we have a very good symbiosis, because at the end we want to reduce inflammation for a better glow and a better well-being for our patients.
So what can happen to our gut? How can inflammation being caused. You know, what are the foods which can cause inflammation in our system? There's also something lots of people are always interested called leaky gut syndrome. What is it all about that?
Yes. First of all, lots of people actually have a good knowledge nowadays about what's a healthy diet. Yeah? So we do know we should have organic food, seasonal food, regional food, and this is something which is quite, which is an important part. But the most important thing behind nutrition is actually to consider the power of our digestive system, and on the other hand, our eating habits. Because if we have the most healthiest ingredients in food and we don't eat it in a proper way, we again have a problem of maldigesting in our body system, and maldigesting in our gut means always producing by ourselves toxins and producing irritation, and at the end inflammation. The most important part of the eating habits is actually chewing, stopping when satisfied. And I'm talking about 40 to 60 times of chewing each bite at least, which is at the beginning in the background, lots of counting, but we can learn it again, how to chew food properly. And the second step is, of course, to stop.
Let's explain that. Why do we need to chew? Because the saliva in our mouth already will start the, you know, fermentation process and help to, you know, take all the, you know, proteins and lipids and everything from our food apart and starts to digest it basically. And if we swallow too fast and eat too fast, what I sometimes often actually do, just because, you know, we never have time, we're so busy, but it's really true, then, you know, you don't get the pre-digested food in your stomach, and so your stomach's already overwhelmed, and then your pancreas and everything. So maybe you should explain that also a little more in detail.
Yes, that's absolutely right explanation. Actually, the saliva has two main things to do. On one hand, the saliva is responsible for providing our system already with digestive enzymes. And the second thing is, of course, to clear out our sensors in the mouth for what we are eating. So we need those liquid food. In general, the perfect swollen bite is actually one part of what you put into your mouth and two parts out of your saliva. So this is actually the perfect swollen bite. The thing is, because of the genetic way we are constructed for the last 10,000 years, we don't have too many enemies at the end, outside, who are disturbing us when we are eating. So every process in our body exists only once, and especially in our digestive system exists only once. So what I do want to say, for example, if we are a deer who is grass feeding, they have put their head down to the floor and can't see any enemies. So they are really in a rush to put as much food as possible in a short time into their digestive system. But they have one thing they can do later on. As soon as they fill up their first stomach, they sit down, observe all the areas around them, and have the possibility to rechew the food. This is something which we can't do, so we have to do it in first line, and that's the importance here about chewing. What happens later on in our gut system, if we don't connect actually all our food with our enzymes, the bacteria in our gut system will digest the food later on, but they digest the food for their own purpose, which means they look first on themselves. They are quite egoistic, and whatever comes out at the end is allowed to be resorbed or destroys our gut lining. Because if bacteria gets too many carbohydrates, for example, or not pre-digested carbohydrates, they go into fermentation. The same process is in wine production as well. The other thing, and then they produce, the bacteria in your gut, actually alcohol and gases. Another problem is proteins. If we don't chew them properly enough, our acidity in our stomach, or if the acidity is not enough in our system, or if we overeat, eat too much so that our digestive liquids cannot digest the amount of food we are eating, then you have at the end result out of proteins, again, maldigesting. This is called putrefaction. And then you have a toxin production together with gases again. And all these products actually at the end destroys our gut lining. And at the beginning of your question, you already mentioned the so-called syndrome of leaky gut, which means that you have microscopic holes in your gut where suddenly food particles or any other stuff like bacteria, yeast, but even maybe small parasites can join into our body system, and the immune system has to react with deficiency and inflammation.
This is so interesting. I'm so glad we're talking about all of that, because you know, when you're on your daily life, you don't really think about it, and you just, you know, go through the day. And then I think if we really really watch and see, you know, maybe we're bloated often, or we have gas, or you know, we feel like stomach pain, or all kind, we should really listen to it and see, maybe, you know, this could be the reason, or you know, we can maybe change little things in our diet or in the way we eat, and maybe can overcome all those problems, which, you know, I want you to just you know, learn about it, think about it, and maybe try to adapt to this little part of our lifestyle, which is so important. So what actually, you know, if we have problems with our gut, with our digestive system, with the way we eat, what in your eyes are like the biggest mistakes you can do, which can be seen on your skin right away? What do you see, like, you know, how does it correlate, the gut health and our skin?
On one hand, the skin actually is a reflection of our inner soul and of course of the gut system. So as soon as you see symptoms on the skin, actually the gut system shows on its mucosa skin most of the time already a severe damage before, because the first symptoms would be in our gut system, and later on they are be seen out on the skin. Which is what is a possibility is if you are trained, especially in Chinese facial medicine and diagnostics, you can even find out of facial diagnostic what's going on the system. For example, if the liver is not in perfect conditions, yeah, it's quite often to be seen on the side of the head, and especially also in the forehead here. Also, a very intensive wrinkle over here is also a sign of lots of stress and anger in the life itself.
Anger.
Yes, the other possibility is, if we're talking about the digestive system, we have the large intestine system, which is more on the side of the mouth, the small intestine system, which is here up on the face. And these are typical areas as well when, for example, teenagers get their hormone dysbalances or acne, is something which you can do out of diagnostic of the face, where are the problems and not. For example, as I said, here is the small intestine. We have here the hormone area, which is quite common in the puberty, that people, the young people, male and female, have their acne problems over here. The yeast itself are the stomach, for example. Then on this, so the yeast goes out till the side, connected to the liver area as well. And these are typical, or actually possibilities also on diagnosing what's going on. It's not only a diagnosis for acne. You see rashes, inflammation, you can see psoriasis and stuff like this in those areas too, or even some more vein notification and some spider navis. I don't know if it's the word in English, it's in the Latin, it's spider navis, which you can see there as well in special areas, which you can use as when problem may occur.
Yeah, so when we have like our, problems with our skin, whether it's acne or, dry patches, eczema, psoriasis. What is a good way to, do diagnostics? So obviously you don't just jump on your face and you do all kinds of crazy treatments on your face. Obviously you really want to get to the bottom of it. Is it hormonal? Is it maybe an allergy? Is it something which comes from certain foods I'm eating? Is it something, related to a medication I'm using, or any other problems? This can be really figured out by a good analytic doctor. So what is it, what we should really look out in our lab work, for example, or what kind of test should be done? Maybe eine Stuhlprobe, wie heißt denn das auf, auf Englisch?
A stool diagnostic and microbiome diagnostic. Yes, but on one hand, an important thing which you mentioned already, that very often intolerances are actually connected to skin issues on the outside as well. There are a few products which are known, which are not ideal if you have skin issues, but of course this is just in general speaking. It's, for example, gluten, it's cow's dairy, it's soy, it can be eggs, nuts, fish, and shellfish. These are typical foods which can be connected to some issues on the skin itself. But it doesn't help if as soon as you have some problem, some rash or some eczema, that you stop all things to be eaten. It's a good idea to do profound diagnostics. On one hand, as a hormone diagnostics, it's important to check on all, on estrogen, on progesterone, on DHA, on the stimulating hormones. So these things get really a profound information about the health situation. Another thing is parameters have your minerals have to check, but also your vitamins. Important is as well to find out about your antioxidant levels. Another important thing, except of the antioxidants, also to see how much is your acidic level in the system, because acidity, which is very well connected to inflammation, is actually the most common cause, because people most don't acid. To make it very brief, what does it mean? Acid food. Vegetables and fruits are in general considered as alkaline, and all other things what we can eat, which are normally portion in our diet, is considered to be acid. I do know, if I speak roughly that way, that I'm talking a little bit about in general speaking, but if I do tell everybody the exceptions on acid food and alkaline food, it's not so helpful than speaking in general. Vegetables and fruits, but especially vegetables should be 2/3 of your diet. Yeah.
Yes. So if we now have a skin problem and we done all the testing, etc., maybe we have some deficiencies with vitamins, or what are good vitamins you would suggest taking, or any kinds of like supplements and taking for helping skin health? Obviously, when we start discussing supplements, especially the common vitamins, I mean, supplements in our line basically are a little away from this normal vitamin, multivitamin. It's more innovative and more herbal to help fight inflammation and do telomerase activation and all this kind of stuff. But the typical multivitamins, that's something, lots of people just, go in the store and grab it and say, oh yeah, it's better to take it. What is your take on vitamin in general? And do you think we need to maybe check on our blood level as well? What is even necessary? What is good for the skin? What is maybe counterproductive? And what should we look out for when we look for the right supplements?
Depletion and depletion of vitamins and minerals, but also
I can't hear you so well. Is everybody? Is this Michael? Is the Is the connection really good?
You may need to turn the volume down a bit.
Us, our volume. Wait, I turn. Maybe it's just my volume. Wait. Try now. Okay, Max.
Is it now better?
Yeah, it's better. Better.
Okay. Barbara?
Yeah, I hear you. Do you hear me? So,
About all the supplementation and food. Yeah. Honestly, the thing is, of course, to take singular supplements like vitamins in high dosage or minerals should always be prescribed after doing a blood test, because because in theory that, for example, selenium is a powerful tool for the skin as well. If you have a high selenium level, you will not have any benefit out of it. So taking supplements out of the blue is something which I would never recommend. A few supplements which are very good for the skin itself are, of course, the antioxidative vitamins like vitamin E, A, but also D, the B vitamins, folic acid, biotin. So these are good ones. Coenzyme Q10 as well, but also herbs like turmeric, but also basil, rosemary, parsley. These are all herbs as well, which have a very good impact on skin health as well as some products which you can use like artichokes or beetroot extracts or berry extracts, which all have a very good effect on the skin itself. And on the gut health too. But important before you choose any supplements is always, in my mind, to make the decision of, or actually to do a profound testing. On one hand, you can also find out how does your microbiome look like, to do a good stool sample, which is nowadays also possible to analyze in genetic ways, so that you really know exactly what, how do your bacterial flora looks like. Because if you take the best supplements, but you have, let's say, a gas-producing bacterial flora in your gut system, this damage which is done out of autotoxification out of your gut will not be possible to be repaired out of supplements only. So the connection for the health is always to be seen in general and in holistic way. Yeah? That's in my mind a necessary tool.
how much water do we need to drink? There's like lots of, some people think we need to drink like 5 liters of water, or, you know, what is actually good, what really benefits our skin, and what is the myth around it?
As a good water supplementation, or actually good drinking habits. Yeah, on one hand, it's about 2 to 3 liters in general would be a good idea, but a little bit it is depending on how high the calorie intake of the person is as well, because the higher the calorie intake, the more liquid is necessary. Another problem is if you drink then too much. If you go above 3 liters per day of water or herbal tea, then it is necessary to do a little bit of supplementation of normal salt. But first of all, if you use a little bit, a breeze of salt daily as well as an extra supplementation, you have to be checked as well. What about your blood pressure? What about your sodium levels in your system? But the more you drink, and above 3 liters, you wash out a lot of minerals as well. So you have to be aware of that. This is a combination which you have to consider. So just giving a recommendation of drinking 4 or 5 liters a day is far too much. Yeah. The other thing is, it's important also when you drink your water, you know, because you should not drink it together with your meals, because then you disturb the digestive system in their digestive way, because you dilute the digestive liquids. So it's better to drink between your meals and not together with your meals. That's another very important hint on a healthy gut system.
Very good. So should we dive someone in? There are so many questions. One question just now I saw, what about IV infusions? I'm actually a big fan of sometimes getting an IV drip to get my vitamins. I need a little glutathione and a little this and a little that. So it's something I like to do, you know, on a regular basis. Actually, what you guys do, a lot of vitamin drips in Viva Maya. What is your take on that? What should also with this, in this regard, you know, we shouldn't just like go and have blindly like some drips. I think it should be prepared in the right way. And what do we need to pay attention to? Because there's a lot of, it's like a trend almost to, you know, to get vitamin drips.
The advantage of vitamin drips, and as you said correctly, at Viva Maya we do lots of vitamin and mineral drips and supplementation, not only orally. The advantage behind an IV drip is that that an unhealthy gut mucosa cannot resorb all the supplements you are taking in a proper way. The good thing about an IV drip, you know exactly what was the dosage which came into your body system. That's one good thing. The other thing about the vitamin drips, again, it's important, of course, that it is done by a professionalist who is really knowing, who really knows what he is or she is doing. That's another important thing because, for example, vitamin C is something which lots of people think they can do on and on. It doesn't matter if they do it or not. But for example, there are some kind of weakness in our enzymes, which is then afterwards not possible to deal with a vitamin C drip in our body system, and that can make them really sick. It's called the glucose 6-phosphatase deficiency, and then you will not have any benefit of doing vitamin C shots. So, and that's with all supplementation, you have to really know what you're doing with a patient. It's a question about the dosages, and it's the question about what you want to achieve. And as you mentioned, for example, glutathione is something which is really beneficial for the body system, but it's again also a question of a dosage. Do I do it daily or every other week, or do I have to do it months-wise? It's a little bit depending on lifestyle as well, because first of all, we have to know what is actually the base level of your body system which you have right now, because then you can make the decision which is the proper supplement and how much is the dosage you should use. That's our idea of IV.
The best thing would be to come to Viva Maya. I really want to come. Max, I'm going to come. I don't know what's going on with Austria right now, but I'm planning on coming with Charlie. So
we've got our first person to dial in. Berfu should be on the line. Sorry if I'm saying that wrong.
Hi.
Hi. Oh, sorry, I still have a strange background. Hi from Germany.
Hi. Welcome. That's a funny background. Bibliothek Hamburg. Karl von.
I'm working at the library, so sorry for
That's
that.
cool. No, that's cool. We like it.
I would like to know if it is possible to heal the gut system from former diseases, because I personally, unfortunately, had to take a lot of antibiotics when I was a child, and I still struggle a little bit because of that. And I also take probiotics, but as soon as I leave, I feel like ill and sick. Is there anything to do, like fasting, for example, or any tips?
I think you need to go to Viva Maya for that. I can already see this in your cards. You know where the clinic is? It's in Austria, Altenaussee.
Okay, no, I don't know.
But Max, what can she do? Let's.
On one hand, of course, fasting could be an option, yeah. But altogether, you actually need a plan for an individual plan for your system of how we can help you of healing your gut system. It is absolutely possible, even if in the use you have taken lots of supplements. It's of course a little bit a question of time. But first of all, it's important for you, for example, to find out how severe is your leaky gut system on one hand. On the other hand, do you have any intolerances, for example, of your body system? The other thing is Is there some kind of food? Is there some overgrowth of yeast in your gut? Is there some wrong bacteria in your gut system? And then it needs a cleaning of your gut, a gentle one. It's not, I'm not talking about doing some enemas or colonics day for day to get a sterile gut system, but a gentle cleansing as it is done in the Maya treatment makes absolutely sense for you to achieve your goal. And then with all of this, you will find out maybe that you have to add a certain type of probiotic. Probiotics are working normally quite well, but important is that you know exactly how you use them, when you use them. And the other thing is it's a very gentle treatment for the system. What do I mean with gentle? If you constantly don't treat your gut in a very good way, the probiotic is not strong enough to deal with the problem itself. So it's a holistic approach of proper nutrition, starting in a proper healing process, of course, to have to give also your gut system daily a gap of about 14 hours of no food intake, so that it's really possible that the gut system itself has a chance for reparation and regeneration. And the best version of this is canceling dinner and not canceling breakfast, because at breakfast time our system, gut system works the optimum way. At lunch it's good, and at dinner it's the worst. And if you want to optimize intermittent fasting, actually dinner has to be cancelled and not any other of the meals. Yeah? When you're on that way, and you will see there will be a good achievement for yourself. Another important thing is as well, although you got lots of antibiotics in your youth, the first step is to accept that this has happened, and to go just the steps in front to see, okay, now I'm doing something, and forget the blame about what happened, yeah, because that's something we can't change, but we can go now directly into a therapy option and into a better life. Yeah.
Thank you very much.
Welcome.
Max, I have a question to that. So if we have like a problem with our gut and we, you know, we feel we took the wrong antibiotics for a long time, whatever. So are there certain foods, even though they're super healthy, let's say, you know, eating a carrot, yeah? So you eat a carrot and it's hard to digest, and could that not be then quite harsh on your stomach? Should we then not try to really be like very gentle to our stomach and maybe eat a porridge, or, you know, something which is like easy to digest, and have some teas and stuff, and really heal our stomach without overpowering him?
As if you want to heal your body system, and especially your digestive system, of course, as you do with any other problem of the body, you have to give these organs actually a rest. What does it mean to give the digestive organs a rest? Is, for example, skipping all the raw food out of our diet, because raw has excellent ingredients. So I'm not against raw, but if I want to heal the body system, I want to give him as gentle food as possible. And when we do think back as when we have been babies, the first steps have not been that we eat raw food. The first step was all cooked food, and after breastfeeding, of course, yeah. But after breastfeeding, we do not start with raw stuff. We start with actually cooked stuff, because it's easy to digest. And that's it doesn't mean that we have to eat baby food, but important is for the rest of the gut system that we eat actually cooked food, and that we really focus on the eating habits itself. Yeah, that's the first steps on a healthy healing and regenerating diet. Another
So
thing,
everyone with a problematic stomach and gut system, let's not do the whole vegan stuff and become like super obsessing about, you know, raw and all this kind of stuff, because that can also go in exactly the opposite direction. Because if you don't digest well, this can cause inflammation as well, right?
absolutely right. And as you mentioned, the vegan diet itself, there is in our mind a tiny problem about this, yeah, because what's the benefit of a vegan diet is that it is a very highly anti-inflammatory diet, because at the beginning, because of the fact that it is a very alkaline diet. As soon as you go to a very specialized diet like vegan, but also a little bit like vegetarian, you need lots of knowledge about nutrition behind it, and actually the ingredients of all this kind of foods to give to your body at the end all the nutrition which is necessary to achieve. Another thing is when you're going on a healing process, as I said, you need cooked food, but on the other hand, there are special foods like, for example, onion, garlic, but also cauliflower, cabbage, spices, which are all irritating the gut system in the healing process. It's not that this food is unhealthy, but for the purpose of a healing process, you have to avoid food which is hard to digest, and also food which is quite hard to digest are lentils and beans. And as soon as you go vegan, you need those kind of things for providing yourself proper proteins, and they are harder to digest. In my mind, I would recommend to have maybe 2 or maximum 3 days of vegan food per week, and the other days need some other nutrition as well. But to have a 24/7 vegan diet sooner or later can cause a little bit of problems on the body because of very often malnutrition. Yeah. At the end.
Someone was just asking about celery juice, because that's like a trend thing, you know, lots of people are just going on celery juice fasting. What is your take on that?
Yeah, so celery juice itself is something, if you have a healthy, good gut system, you can digest, of course, on the empty stomach in the morning. That's where they normally eat a celery juice. And then important, as I said already, you eat a celery juice. It's not my not native speaking English. It's actually really meant that way because of the fact that celery juice is raw, and then you have to connect, as I said at the beginning of our session, you have to connect it with 2 thirds of saliva. So the perfect swollen celery juice bite would be 1 part celery juice and 2 parts of saliva. Yeah, that's at the end.
So you need to eat your celery juice, and that is not just for celery. Any kind of vegetable juice you need to eat. So don't chuck it down. Just really like spoon it. That would be the optimal way of drinking your juice.
Yeah, that's right.
Okay, next one.
So the next person is Nicole.
Oh, by the way, what about this in the morning, hot water, ginger, and lemon?
So this is another tool which helps the system to wake up. Important is that the water is warm, so that your body system can directly digest it and doesn't need any energy for heating this water actually up. And at the end in your metabolism, if you don't have a direct stomach issue itself, it helps you to get more alkaline and activates your metabolism in a good way. So it's to have hot water in the morning, even with a little bit of lime inside or ginger inside, is a perfect start in a normal day life.
Great. So next one. I think we have so many questions. I think we have to do another skin school about this. This is so great.
Next person is Nicole. She should be ready now.
Okay, Nicole. How are you?
Sturm, I'm awesome. Hi, Dr. Schubert as well. Thank you so much for your time. I'm from Denver, so it's morning for me. So good morning, everyone.
How's the weather in Denver?
Oh, it's perfect. It's a gorgeous day today. I am a firm believer in your advice, and I've really tried to live your advice regarding take care of your skin, and it will take care of you. And my question is related to skincare, and how important is it to have a different routine for the morning and the evening, aside from sunscreen? So I would really appreciate your perspective on the difference in the routine and taking care of your skin in the morning and then at night.
So that's a very good question. And this really depends on how active and how many steps your skincare routine should have. So if you are like a beauty junkie and you want to have a maximum outcome and whatever, you can do different routines in the morning and in the evening. I'm personally someone who tries to keep it simple. I switch my serums, but my cream is the same, my eye cream is the same, my cleanser is the same. So I'm not changing too much, but for night I definitely add my super anti-aging serum and my night serum. Yeah, and obviously in the morning you use your sun drops and you use your anti-pollution drops, because the anti-pollution drops are great for, you know, blocking the HUV light and the pollution out of your skin. I don't know how polluted Denver is, probably it's okay. But, you know, there's always, you know, the little things, you know, especially the HUV light if we work on the computer. And so the routine can be actually completely the same. If you want to keep it simple, a hyaluronic serum and a face cream, morning and night, you know, wash your face obviously in the evening, use a enzyme cleanser twice a week, and then this could be it. But you know, of course can switch it up and add a night serum if you want. So what is your routine like right now?
So I use, in the morning, I wash my face, but I use the sun drops and the hyaluronic serum, and I use the anti-aging serum as well, and then the face cream. And
Perfect.
at night, I use the I use the hyaluronic serum and then the night serum as well, and I'm using the same face cream.
We do exactly the same thing, so it must be right. And your skin looks great.
Well, I appreciate that. And I would also like to say that your skin food and the repair food I take as part of my morning supplements, and they have done wonders for my skin. So thank you.
It's amazing. Yeah, it's amazing. I mean, it's like, you know, when I thought about creating those, I was like, okay, all this research and all the science from the skincare, I was so excited about. I don't only want this for my skin sets, I want this for every cell in my body. So that's why I created them. And I think they're amazing. They're not the typical, you know, vitamins, supplements, or nothing what you find, you know, in the market like that. So it's very, very different, and can be, you know, it's also, if you don't have the time to go to the local farmers market and get your vegetable and everything and all your food, and, you know, get those power herbs from the market, then it's great to have this on the go and to have this on your travel or wherever you are. So it's an easy way to substitute what you need also for proper anti-aging, inner hydration, you know, telomerase activation. So I'm so glad you love it.
I do. I thank you so much. And I am now shifting to the anti-inflammatory diet. So I will save my second question because I know there's a lot of other questions, but thank you both very much. This anti-inflammation skin school has been very, very informative. Thank you.
I'm so glad you could join today. It's so cool. And I'm so excited that you go on the anti-inflammatory diet. Bravo. And keep us posted how it's going, and stay in touch, okay?
I will. Thank you so much.
Bye.
Okay, next up we should have Amna. She's just joining via audio, she or he. I'm sorry.
Hi.
Hello.
Hi, how are you?
Fine, how are you, Dr. Barbara and Dr. Schubert?
Good.
I'm from United Arab Emirates, Sharjah.
Oh, okay. Yes, so nice to meet you.
Thank you. So my question is, I will tell you, my diet isn't the best, but I do eat like something healthy, maybe once, like I do eat healthy, but not that much.
Mm-hmm.
But like I get acne, but when I made like a hormonal test, it was normal. Only my iron was low, so I had to take supplements. But I still have acne, like as Dr. Schubert said, like the liver area and my chin.
Do you eat a lot of sugar? I know in Saudi there's a lot of sugar.
Not Saudi, it's United Arab Emirates.
Ah,
Dubai.
okay. So I'm sorry. So what is your diet based off?
like like I do eat like healthy. Like in the morning, I do eat like, for example, oatmeal, sometimes eggs, and like this.
Mhm.
But for lunch, it's like rice and other things. At night,
Good.
it depends. Sometimes I do, sometimes I don't.
Okay, but this doesn't sound so bad. Max, what do you think?
As the first overview is okay. Yeah, that's absolutely fine. The thing is, what you mentioned about your skin. The good news is, of course, if the hormones are well balanced, then you do know exactly, okay, this can't be my issue. But as you mentioned, also the diet, actually, as I mentioned previously, it's not only about the diet, it's also about the eating habits. So it's really about chewing and stopping when satisfied. And if it is, if your acne is in the areas of the liver, it's actually very often a good sign of auto-detoxification in your gut system, because the organ which struggles most with the toxins is actually your liver, because this is the organ which eliminates the toxins out of your body system again. And this auto-detoxification can most of the time happens because of overeating, not chewing very well. These are the options, or eating too frequently. There should be a gap of 4 to 5 hours between your meals. And another thing which you might focus on is that you really have your meal based on vegetables and some fruits, because you said porridge, which I'm already very happy in the morning because it's a warm breakfast, but porridge itself normally is acid. Then you have at lunch mentioned that you have very often rice with something else. Rice is an acid part. So on your prescription, which I do know it was not complete, but the overview you gave is a little bit on an acid-based diet, and that's something which might help you as well as a rechange, that you increase the alkaline food as a possibility.
Thank you so
When
much.
did your breakout start?
Like when I was a teenager, I even took, what do you call them? Accutane for maybe 8 months.
Yes.
And then it stopped like for a couple of years, and it returned.
Okay.
Then like I mentally thought that if I like kept my skin dry and all of these things, but it was totally wrong, because I started getting your regime, which is the best. I started using the, I think, yeah, for the acne prone skin.
Yes, good. So you hydrate your skin, so you don't dry out your skin anymore, which is very important.
Yes. So I'm
Do you have
seeing
to,
the results slowly.
say again?
Like I'm seeing the results now.
Amazing, amazing. And do you have to wear the facial mask a lot? Do you go out a lot and need to cover your face for,
Yes.
you know?
Yes.
So that sometimes can also at the moment create a little more irritation on the skin and break out. So what's really important, especially then, keep your skin always clean, keep your skin hydrated. Yeah. And you know, for everyone out there who has to wear the mask all day long, take a little bag with your little with your maybe your travel size of your skincare routine with you, and wash your skin in the lunch break, and reapply your skincare routine. That really already helps to keep skin smooth and hydrated and clean. Most important, because behind the mask we sweat, we breathe in it. This is an ideal climate for bacteria to grow, and the irritation from the mask really cuts into the skin, and then bacteria get into the skin, and we experience breakouts. And by the way, I don't know, where's our mask? I created a mask, I developed a mask, a nano silver mask, and this is something super soft, super breathable, and this nano silver is antibacterial actually. And, you can go on our website, you can wash it, and it's super, super soft. I don't know if you see that. It's like our mask, so maybe you replace yours. It's the one I tolerate the best actually.
Thank you so much.
So nice to meet you. Keep us posted, and maybe go a little further into trying to have a more healthy diet, anti-inflammatory. Sometimes, you know, when you start doing it, you become kind of not obsessed, but you're getting fun with it, and then you want to be better and better and better. And maybe this is something to really keep going, and maybe this will help you in the long term. But stay on your Sturm routine and keep hydrating. Never dry out your skin. That's never a good idea. Okay.
Okay, thank you.
So nice to meet you.
You too. Bye.
Okay, we've got two more people. We've got Jan next, so she should be popping up now.
Hi, Jan.
Jan, are you there?
Yes, yes, I am.
Come here, Uli. I want to show you Uli. No, she's taking pictures. Come on, Uli. Come on.
Come on, Lily.
Come on.
It's your time.
You know what? She's standing here taking pictures of me, you know? That's my friend Uli. And
Hi.
Uli's been with me from day one and built the clinic with me and helped me with everything, with the products, with my patients, with everything. And she's my really best friend. And so I want you guys to meet her because she's here and taking pictures.
Hey, Uli.
Look, say hi to Max.
Hi.
I bring Uli to Altenau too, okay?
Hi.
Hi.
Hi, everybody. How are you?
Huh? Good. Nice to see you.
Nice to meet you, Dr. Sturm. And nice to meet you, Dr.
Schubert.
Schubert. I was in Austria. I was in Austria about 2 years ago. I should have come to, I didn't know about your clinic, but I definitely would have come and visit. Dr. Sturm, it's such a pleasure to speak with you. I met you at Barney's. I used to be an associate there. I work for Clay Poe, and I am a beauty curator now. So I work virtually, and I recommend your products to all of my clients. And I love the products myself. I use them, but you know, I'm a product junkie, so I have things from every brand. And so I love the products, but one of the interesting things in terms of sell through, and I happen to be a power salesperson, I'm recommending all the serums and the glow drops and everything. But when it comes to the supplements, I mean, it's a very new area for clients, you know, and they're kind of, you know, reluctant because they're not sure what they're going to do. You know, they have like phobias, I think, about taking, you know, dermatologic kind of products rather than over-the-counter products. And the derm products are probably more pure, even though there's no quantifying, you know, FDAs and things on vitamins. But when I don't really recommend enough of them. And I'd like to start to really get more significant with recommendation. And I also enrolled at Cornell. I'm in a nutritional program called Nutrition and Healthy Living because people really want to know how to live your longest, best life. So I really want to integrate that conversation in recommending skincare because people really want to know. And your products are not inexpensive. They're up in the luxury arena. And most of my clients want better. So I push them to those directions. But, you know, it has to make sense. So I kind of like...
Why it's good. That's why it's good that you're signed up to today's class, because it's so interesting. Because, you know, skin health or overall health is not just like, you know, putting products on your skin. It's like the way we live, the way we, you know, eat. Everything together makes really the perfect skin, you know. And with the supplements, my idea was, you know, that I had like this idea about, you know, whatever I just, you know, created for the skin and this anti-aging effects with the telomerase activation, which is actually the most proven anti-aging theory. So Harvard study says it's the fountain of youth enzyme, and it's basically keeping sure that your cells keep dividing, because, you know, what really sets us apart and determines the aging process is the number of cell divisions. We humans have cell divisions between 40 and 60. A turtle has 110 cell divisions. So we need to really make sure our cells keep dividing and we go through the whole process, because that's what keeps us young. So telomerase activation, inner hydration, I have the adaptogens, anti-inflammatory ingredients, glutathione, antioxidants. It's just a whole, you know, collection of herbs and ingredients which help, you know, your inner health, with anti-aging, inflammation, with hydration, what also we do with our skincare from the outside. So to support what we do from the outside, and you know, it's not always possible. I was, where was I? I was in Florence last weekend, and we were going for a walk, and everywhere was growing the purslane everywhere, through the stones on the sidewalk. It was great, but you can't find it always everywhere. So where do you get it? So I put it in the supplement for us to really have it every single day.
And that's anti-inflammatory in a big way. I know.
Yes, not just anti-inflammatory, it's telomerase activating, it's rich on omega-3 fatty acids, beta carotene, vitamin C, E, A, it's wound healing, it's antioxidant. It's just such a powerful herb, you know how powerful it is when it comes through the stones on the sidewalk. It's quite something.
Really, that's fabulous. You might, this is just a suggestion, because people really, you know, they don't know what they don't know. So you have to educate them. And maybe there could be a little kit that's an anti-inflammatory, even though much of your, you know, what you do is all anti-inflammatory. It sort of makes it easy of the 1, 2, 3. It's a set, you know, Americans
Very
like
good.
that.
Very
You know,
good. Guys, did you hear? We need an anti-inflammatory kit.
Absolutely. You
I think it's a really good idea.
Thank you, Jan.
Yes, I come up with them.
Yeah, very
I come up
good.
with them a lot. But honestly, I believe that people really want to know. And if you have it all together, just like something like you would travel like a TSA kit, even though we're really not doing that right now, but people want to know, and it organizes people. And when you recommend it, you say, this is definitely an important element in everyone's, you know, skin DNA, that you have to have it.
I love it.
Yes. So I am so excited, but I do, you know, love your products. I am with Cosbar, you know, Cosbar. I've been working as a virtual stylist there with some of the people from Barney's. It's crazy. And, you know, connecting to some of those clients, you know, working remotely. It's really a different thing. But it's working well.
Thank you so much for always recommending my products. I'm very grateful. Thank you.
Of course. Absolutely. With pleasure. With pleasure.
And so nice to see you.
Yes. Nice to see you.
Stay in touch.
I will. I would love to continue that.
Yes.
Absolutely.
Yes, please. We have your email. We get in touch with you.
Perfect. Perfect. Love that.
Thank you very much.
Thank you.
Thank you.
Okay, so we're almost out of time. We have one more person. Leah should be there.
Hi, Leah.
Hi, I'm trying to figure this out. There we go. Hi.
Hi.
How are you?
How are you?
Good. So I'm so excited to be on this. I'm own my own skincare practice, just a single little practice here in Colorado, actually.
Cool.
So I'm another Colorado person. But I was intrigued with the whole inflammation combo that you both are doing today, because I have celiac disease. And I didn't know I had celiac when I was young. So my poor parents were trying to figure out what's wrong with their teenager. You know, I'm tired all the time. I'm depressed. I have acne. You know, so they bought that juicer that was popular and tried to juice. You know, I would go get B12 shots, and I was having female issues, you know, cysts on my ovaries, you name it. My body was starting to just slowly break down. And so I think people don't realize that importance of understanding their body and inflammation and how it really affects them, and then, you know, problematic skin. So at 17, I got into the skincare industry because I had such severe acne and I was tired of not feeling good all the time. So, you know, I worked for Nordstrom, Saks Fifth Avenue, Barney's, you name it. I worked it because I just wanted to educate myself on ingredients and what I'm putting on topically, let alone internally. So basically, as a single owned practice, you know, I have the skincare part down, but it's the internal part that I suffer or struggle with my clients, like not knowing what to prescribe to them or offer them on a supplement level, because there's so much out there. But as a single owned business, the lovely wholesale accounts, you know, it limits someone like myself not being able to offer certain products that I'm so passionate and believe in, you know, because I'm not a big Sephora or a 5-star Beverly Hills spa yet. So it's frustrating. So I would just love to know, for someone like myself who's a little limited right now, I did just add the IV therapy to my business because I believe in the drip that you were talking about earlier. But what would you recommend for someone like myself on the supplement side for my clients until I can build myself up to be able to afford, you know, Dr. Sturm, who's like a rock star in my opinion.
I love you. Thank you.
Yeah.
No, it's great what you're doing. I think it's fantastic, especially when it comes from your own needs, and you must have gone through really like a lot. And, you know, now you probably figured it out, but maybe Dr. Schubert has also a few things to recommend, especially also, you know, for your underlying problem.
Yeah. On one hand, the first recommendation, as I said during our session as well, is what you easily can recommend as the first steps for your people is, for your patients itself, is focusing on the eating habits, really having maximum 3 meals a day, maybe skipping dinner. Dinner should never be too late. Drink between your meals, have enough time between your meals, take yourself time for eating. Chew your food very well. Of course, this is something where you can't make money out of it, but you will get more and more clients, because as soon as they start to change a little bit their lifestyle, you will have them asking what's going on, because you always need a healthy gut lining to resorb all the supplements you want to prescribe as well. And in first line, to help people to get rid of their acidity, for example, to have in between your meals once or twice some base powder, which is the main ingredient, sodium bicarbonate, to help to reduce acidity of the body system. And then you gradually can start to introduce antioxidants, some other skin food which is connected to CoQ10 or the B vitamins. Important as well is to have a good level on vitamin D, a very good level on zinc, so you can start with the small things first. As I said, I would prescribe people zinc, because zinc is one of the most important minerals for most issues, honestly. Then to have a good level of vitamin D, which means you can ask them to bring you some reports about vitamin D levels in their blood system, and their goal should always be on the upper range of the scale. And then you have already a few tools to empower their system on the healing process of the gut, and your skin gets better. And then you start gradually to use the supplements and ingredients, and what Barbara Sturm has in their assortment as well, because they are well balanced and really working for against inflammation and skin repairment very well.
Yeah, I just have a lot of patients that want like that instant fix, you know?
That's not possible.
You know, and it's not possible. And I try to tell them my story, you know, like, you know, I ended up with a hiatal hernia, took me to the ER, and because I was so inflamed, they did a biopsy of my small intestine, and that's how I found out I had celiac. And I was like, what's celiac? I have no idea what that even is. And then I just went completely gluten-free. So like Dr. Sturm said, like you can think you're eating healthy, but you're really not eating for your body type. And so I like what you're doing as far as testing. I think that for me, you know, I'm limited because I'm not a nutritionist. So I'm, you know, but I would love to offer certain supplements and products, but I like what you said about testing your blood first to make sure that you're taking the right vitamins for yourself. And this is like way too much information, but I'm pretty like straight shooter, is, you know, one time I took a vitamin and the next day I used the ladies' room and I looked down and there's the whole vitamin there in the lovely, you know, elimination process. So I didn't even break down the vitamin. Like, and so how much truly when we take vitamins orally are we absorbing really?
It is the chances of a resorption very well, but it's depending really on the products. Yeah.
Right.
And of course of the dosage. If you take too much, you will not resolve it. If you take not enough, you will have no result. But there's lots of background information about nutrition, about supplements. It's a whole education what we have to do to get all this information as well. And as you said at the beginning, that's what we have common, I think, all of doctors and all nutritionists and beauty specialists have in common that people destroy their body over months, ages, or years, and suddenly want a therapy within a second and everything should be solved, but this is not existing. It takes time to destroy and it takes time to heal. Yeah, and that's what everybody has to know. And I have very often conversation about what can you do right now, and the first step is, the answer is always, it's your steps you have to do. I have to teach you. I can show you what you have to do to have a healthy lifestyle, because without that one, you will not have an achievement on yourself. And the other thing is about resorption of supplements. It really depends on what is the coating of the capsule, what is actually the capsule made of, what are the ingredients, because very often I do know brands and products where you want, for example, potassium and magnesium as a supplement for your body, but the ingredients are 120 different products, and then you have to ask the question, what do you need the 18 for if you only want potassium, magnesium? Yeah, and these are things which is over the buying supplements over the counter and as cheap as possible is normally not the answer, because how do you produce a supplement cheap? You can only produce it cheap if you produce it with machines. But so first of all, you have to find a powder combination which is excellent working with the machine, and then you add the few ingredients you want to have in. But the problem is the powder is the problem and not the ingredients. So it's really something which you have to be you have to do research of what products are available in your area, and the first step is always to see what are the ingredients. What do I want to have inside? And if there are extra ingredients which you don't see any purpose for, then you already know this is not a good supplement. As if it is added, for example, cellulose, this is nothing you have to worry at all, because it's just fibers and it's supportive. Because, for example, if you have a pure selenium capsule where you have 200 micrograms of the substance inside and you put it into a capsule, it could be hard to see it, yeah, in the capsule itself. That's why they put in the smallest a little bit of cellulose and the 200 micrograms inside to have a possibility to give you something in your hand. But the only ingredient is then is selenium, cellulose, and that's it. No colors, nothing else. Also, if a capsule has a color, is colorful, what is the color for except for poison?
Yeah, not so good. Yeah.
Yeah.
Well, I feel like you pay.
Quality matters.
You pay twice.
Yeah.
You pay cheap, you pay twice. And
yeah, exactly. That's a good final statement here. You paid twice. I think we all learned this the hard way. Yeah.
Thank you.
Thank you so much. I wish you all the best. If you ever need us advice or whatever, just let us know.
Sounds good. Thanks, you guys.
Thank you.
Thank you. Nice to meet you. Max, this was fantastic. It's always such a delight to talk to you. We have to do this again and again and again and again. And I'm coming to visit you. And everybody out there, let's chew our meals tonight. Well, better, we cancel our dinner tonight. Now I feel like, oh God, I shouldn't have dinner. So, you know, every time I talk to you, Max, I feel like I should change a bunch of things. I start tomorrow. That's a good deal, right? Okay, everybody, we are all on Dr. Schubert's recommendation. Promise and stay with us. And I try to come next week, latest in 2 weeks, and we will always do our skin school. That's really close to our heart, and good to see you. And I wish you all a great day or a great night wherever you are. Big kiss. Bye, Max.
Thank you very much, and thank you for the invitation. Good luck and stay healthy. Bye, Barbara. And all of you, thank you very much for joining us tonight. Bye-bye.